This is your Houston chiropractor, Dr. Gregory Johnson, and we have Donald here with us today who's been suffering from horrible low back pain and leg pain that's been devastating his life for how long now?
10 years.
10 years, and it's gotten worse over the past what?
At least 6 months.
Okay, and you've done what so far?
I've had 2 surgeries. I had a laminectomy in 2005. I had a discectomy last year. I've had cortisone injections, acupuncture.
Pretty much everything. Physical therapy, all
Physical therapy, everything I could try.
And really nothing's really helped.
Nothing lasting relief.
So basically you've had what's called failed back syndrome.
Failed back syndrome after the surgery, yes.
Yeah. So okay, so let's show the folks how we're treating you here,
yes, sir.
And then you can let them know how you're doing afterwards. Let's take a look at your posture first again. Let's have you flex your head forward and backwards for me first, please, Donald. And then neutral. Now he's got a little bit of forward head posture and the right translation of his cervical spine head to the right, so that's a negative SX cervical on a 3-dimensional Cartesian coordinate system axes that we use to evaluate a person's posture, which we do every single visit before and after the adjustments. And his hands are out in front of him, so you can see he's got a little bit of forwardness of his shoulders too, rounding forward, which increases the weight bearing of the spine all the way down. So first thing we're going to do, even though he's had back surgery now, we're going to decompress him. So go ahead and lay on your back there for me, Donald. And let's slide up this way. A lot of patients who have had surgery are reluctant, let's slide up a little bit more, to see a chiropractor because they're afraid we're going to mess up some of their hardware, pins or screws, plates, rods, cages, whatever they have in there, and mess up their surgery. But doing this will not harm any surgical procedures that have been done, any of the ones he describes, laminectomy, discectomy, even cervical fusions with instrumentation we can do this on, because the vertebra that is fused, now see he's got a decreased reflex here on the right one compared to the left one. So we'll show you what that looks like afterwards. There we go. So we got him pinned in tight down to pelvis. Take a deep breath through your nose. Oh boy, that was a home run. Felt that all the way down, didn't you, Donald?
Yes, sir.
All right. Yeah. Watch this. Look at the difference immediately. On both sides, actually. So then we're going to adjust his cervicals. Okay. Tilt right just a little bit. That's better. Okay. There you go. Good. Have to catch Donald between bucks every once in a while. But he's been dealing with this pain for so long, he's had a hard time doing almost anything. So we're going to kind of roll sideways, remember, and sit up sideways and then come over on this table. There you go. It's very important when you're getting up and down from a lying down position to get up sideways and don't sit straight up. Okay, let's go on your tummy there for me, please, sir. So we've adjusted him on the y-axis, decompressing his entire spine from his skull down to his pelvis. Now I'm checking his leg length. Right now they're exactly even, and that's great. They stay even, but that still tightens up right there, doesn't it, Donald?
Yes, sir.
So we got a little bit right down here at the left SI joint. So we're going to adjust the left SI joint first. And you notice we're adjusting that right in the plane of the SI joint, which is really kind of a oblique plane. It's called SI joint, sacroiliac joint, because this is the ilium. This is the sacrum, therefore sacroiliac joint. It's the largest joint in our body. Next to the knee's what is said to be the largest joint in our body, but truly the surface of the SI joint is actually larger. The knee's a more complex joint. Now there's L5. I hit that straight P to A in the Z-axis. L4, L5, and that's what they operate on, you know, on L4 and L5, right?
Yes, sir. L4, L5.
Yeah. Twice. He's had 2 back surgeries in that same area. So he's got a lot of scar tissue built up down here too, which we've been working on with some really deep tissue work here, using my elbow here. Those
Good.
Myofascial release. This is one of those hurt so good things. And I'm putting quite a bit of pressure in there as well. Now, when I first started doing this on Donald, he'd almost jump off the table, but right now he's able to handle it a lot better. And he's breathing through it like he should. Breathing's a big factor in healing for people with any kind of spinal related disorder, including herniated discs, sacroiliac problems. Many physicians, orthopedic surgeons, and neurosurgeons don't pay attention to the pelvis or the sacroiliac joints or the sacrum because they're looking to do surgery on the disc of the lumbar spine. And that didn't help you a bit, did it, Donald?
No, sir.
So what we've been doing is we've been working on his pelvis as well as his lumbar spine because they work together. The pelvis is the very base of the spine. Now, I am going to use the turbonator on him because he's got some significant scar tissue, so bear with me, it's a little loud. On his gluteus maximus, medius, and piriformis muscles in his pelvis and sacroiliac joints on the side, the tensor fasciolatum muscle, which a lot of people call the IT band, and then the quadratus lumborum, multifidus, and erector spinae down here in the lower lumbar spine as it attaches to the pelvis. So I'm going to hit his left SI joint one more time there, L5, L4, and L3 right here is probably the sorest one.
Yep.
And L2 is also sore there. You usually find that once you have surgery, people will feel the pain above and or below the areas of the surgery, especially in fusion cases. Okay. And just let all your out here. He's very locked up all through his thoracic spine, so we're not getting a lot of audibles through there, but we're still moving the thoracic spine and his ribs. And again, we're putting some really deep tissue work in here. You got some sore spots in there, don't you, Donald?
Yes, sir.
Okay. There we go. Good. Okay. Now, I'm going to recheck him. His legs are still even, but I bet you this feels easier than the first one.
Yes, it does.
Much
yes.
better. Good.
Yep.
Okay, let's turn you on your back now. So, I always decompress from the top and the bottom, so scoot up that way just a little bit for me, Donald. So we're going to check his knees here. And he's got a little bit of play there, but not much, just breathe normal. There you go.
Oh.
Boy, that was perfect. You felt that all the way from your low back, didn't you?
Yes, I did.
So see, we're decompressing the knee and all the way up into the hip joint, and it gets all the way to sacrum L5.
No.
And there we go again. Both sides move really well today. Excellent. Okay, let's set you up sideways and face towards your knee that way. There you go. Good. Now we're just going to check his shoulders. Good. Now this is right glenohumeral joint. Left one we got a little crepitus here. Okay. And just relax your elbows here. Now he's been having a lot of stiffness and pain, achy pain in his fingers for how long? A year or more now. So I'm adjusting the digits in his hands as well as his wrist. There, good.
Wow.
move better today too. You're getting progressively better.
Yes, I am. I feel it.
There we go. Good movement on the wrist.
I think you're great.
There we go. Good. Before I go over here and shoot you, if you wouldn't mind telling our YouTube subscribers and viewers, you come in here almost as a last resort, huh?
Yeah, I think I was sent here by God, actually.
Yeah, praise the Lord for that.
I think Dr. Johnson is fantastic, and he has a very compassionate heart to help me.
Thank you very much. Would you recommend other people that have
Absolutely.
had surgery that are still having problems come and get treatment here?
Absolutely. I've only been coming a week now, and I'm already feeling better. I'm already able to climb stairs much better than I used to. I couldn't even go upstairs. So.
Praise the Lord. Well, thank you so much for sharing your story with us, and let's come over and shoot you now. Do we pull their legs and then shoot them here at Advanced Chiropractic Relief? So if anybody ever asks what we do here, you just say, we're just pulling your leg and shooting you. Okay, now let's have you flex your head forward and backwards again. Now see, his posture's already improved, so we're going to help him improve that even more by pulling those shoulders up and back, flare these hands way back here so it increases the trapezius muscle tonus, and then I want you to shift your pelvis straight right. Yep. And adjust the atlas on the x-axis on both sides, which will send a barrage of neurological information into your cerebellum, remembering this mirror image posture. Okay, you can relax. Now let's have you flex forward and backwards again. Look at the difference in range of motion.
Yeah.
Back to neutral.
It doesn't crick anymore.
That was smooth that time, wasn't it?
It doesn't crick anymore.
Okay, back to neutral. There you go. Excellent. See his head's coming back up and his arms coming back a little further. Good job. Very good. So, if you've had back surgery and are afraid to get chiropractic care, just ask Donald. It will help you still. Doesn't hurt. The only thing that's going to hurt you is if you don't get it treated properly.
Absolutely.
So, thank you for watching, and we appreciate you. This is your Houston Chiropractor. We'll see you next time.